Hello, I'm Paul G, and this is the intro to my series on understanding depression from an insider's perspective. Now, there are a couple things I wanted to talk about before getting started, and that was to make a promise to the viewer that I will treat this as if I'm talking to somebody who's very depressed, that I'm trying to instill some hope in, okay? Not just very depressed, but quite depressed indeed. You know what I'm thinking, but I won't say it, right? I will treat this that seriously. If you will please look, listen, watch, and attend closely to what I'm saying, because I really believe I can help. Why? Well, I guess in the last month or so, I discovered a few things that I wish they had told me 27 years ago, but they didn't. Things with regards to depression, treating it, etc. They didn't tell me this stuff 27 years ago, and a lot of it was from the great doctors Sigmund Freud and Carl Jung, and also more from Mr. Aldous Huxley, who, in my mind, gave the contribution to the understanding of this that really changed me. And he did not speak much on depression. I had to dig up some of this stuff. Okay? So if you will listen to me and give it a chance, I'm not saying that it's true, and if you don't believe me, I'll understand. But if you will please listen, I will treat this as if it really matters and I'm talking to somebody incredibly depressed and I'm trying to instill some hope in them that they can actually do something about it. And I do believe that, especially now that I know stuff that I wish they told me 27 years ago. But they didn't. Can you imagine? Can't imagine. Anyway, will you start with me by learning a vocabulary word? I know this seems irrelevant, but this word is a great starting point, and I think it's going to allow us to think about depression a little better and easier, right? That word is axiom, right? Which is kind of an agreed upon starting point. Now, I noticed smart people tend to use this word, and I didn't know why, and I didn't know what it meant, but the reason they do is because they like to build off of an agreed upon starting point. So we'll think in those terms, and what was the agreed upon starting point that I propose? And we may not all agree with this, but I think most of us can agree that we can treat depression even better. Why is that? Well, we don't know the cause yet, and people have been working on it for over 100 years. That's one reason, right? If we don't know the cause, don't you think it would be possible to treat it even better? I don't know. That's up to you. But I like the word axiom, and I believe we can treat depression even better is an axiomatic statement that even that statement can instill some hope in people. And I myself have learned over the last 27 years how to treat it better and better and better. And frankly, I was not very good at it for a lot of years, okay? And I think in the last 4 or so years, I got way better at it and began to put pieces together. And then I found some of the work of these two great doctors and Aldous Huxley, and it made a lot of things click for me. And I said, well, if I could share with people who are quite depressed indeed, I think it might give them some hope, right? So that's why I'm asking you to listen and please attend to what I'm saying. All right, so we have a fourfold model that is not set in stone. It's not brilliant, but it is a way of addressing depression and addressing one's problems, looking at problems on four different levels: the physical, the mental or psychological, the social, and the spiritual. Okay? Now, the problems could reside in those areas. What would an example of like a spiritual problem be? Well, a loss of the sense of meaning of one's life is a very big contextual one that Aldous Huxley mentioned, and that's a very, very big point that we will touch on. The loss of various things, but including loss of meaning. And remember, a depressed person, as Aldous Huxley said, is often looking through a gray or dark lens through which they see reality. And it's not necessarily reality. They have a gray lens in front of their eyes. So if they look in the present, it looks bad. If they look in the past, bad. Future, bad or hopeless, right? So if we can clean off that lens a little bit, maybe it's still a little gray, but if we can engage in a lot of treatments, micro and macro treatments, right? What's an example of a micro treatment? Something like eating a bowl of vegetable soup, something like taking a walk in nature in the woods, something that may not necessarily cure one of their depression, but things that I believe have a stacking effect, um, And we use the analogy that if you have a jug with water being dripped into it, drop by drop by drop, no one drop seems that important. But the only way it is going to fill is with drop by drop by drop going into it. Or a lot of water. Maybe a macro treatment would be more than a drop. I don't know. But do you see how one drop may not seem that important, especially if you're viewing the past, present, and future as quite bad? If the future looks bad to the depressed patient, right? What is the value in eating a bowl of vegetable soup and walking in the woods or doing a yoga class? You notice something about yoga that's quite interesting? You see these examples I have? What would yoga fit into? Well, I think because of the mind-body connection, it would fit into the mental and physical, right? Physical exercise, a lot of mind-body connection. But then again, some yogis make it a spiritual practice, right? So it could fit into that. And there's people in the yoga class that would make it somewhat social, right? So that there is a example of a very valuable treatment that we could call a micro treatment, maybe even a macro treatment. But there's concepts like that which I did not realize until fairly recently in the grand scheme of things that I really would like to share with those who suffer from this, okay? And I also would like to help other people who are not suffering from depression just understand the whole phenomenon and how it works to the best of my ability, which is not perfect, right? But I think I can make an impact. So we're going to go through Dr. Freud, Dr. Jung, and Mr. Huxley, right? And Dr. Freud, just very briefly, considered one of the major causes of depression losses of various types. Also, less so anger directed inward. We're not going to get into this very deeply, but I just wanted to show you a little bit of the psychological stuff, right? Carl Jung talked about the unconscious a lot. Sigmund Freud did too, actually, but we're going to try to locate losses that occurred, sometimes not very apparent or obvious to us, in the unconscious. And then as we stumble upon those losses, we're going to find the loss of meaning, perhaps, that it began to create in our lives, and use Huxley's theories to make meaning out of the whole thing, right? And I have this little formula here that, again, this is just touching on the psychological stuff that we'll get into because I want to give you a preview of it. But if we have the context around something being expanded to the point where we're able to put meaning to our suffering, it can, in a sense, cause some healing, okay? Broad example, trauma occurs, right? Blocked out. One figures out where the trauma is actually located in the unconscious, sees it. Might result in some immediate suffering. However, if they can contextualize it in a way so that it benefits them and others, for instance, saying, okay, this did happen and it caused a lot of pain, suffering, but now I'm aware of it and I'm going to make sure it doesn't happen to other people through education or something like that. That has created a certain context and meaning around it that at least partially heals it and makes it easier to go on, rather than harping on the fact that in the past this damaged me so much that I cannot even function in the present or the future, right? Or how about you orient yourself that in the present I'm going to do something that allows me to help people in the future so that what happened in the past was not in vain. That's basically the formula, right? I said it in a sentence here. And that's just an example of the psychological stuff we'll do. We're going to talk about social stuff, talk about spiritual stuff a little bit, maybe get a few tips from the Buddhists. I'm not going to push Buddhism on you, but we'll get a tip or two from the great Buddhists of all time that I think can help dramatically. So why should you listen to me? Because I'm going to try as hard as I can as if I was talking to somebody who is incredibly depressed, right? So that's one reason. You know what another reason is, though, that I kind of like? Artificial intelligence said it was pretty good. Gotta be worth something, right?